had the great opportunity to be at UGA to obtain both my bachelor's and my pharmacy degree, and I just really feel like UGA is home for me. And so to be able to come full circle and now be the PGY2 here was just a really kind of rewarding experience, and it's something that I always kind of looked forward to.
I think our site provides a very unique opportunity to work on both teaching, research, clinical research, and one of our missions is to make a resident capable of walking into any VA and practice as a clinical pharmacy practitioner with their feet running.
We're a smaller program, and I think because of that, that really allows you to be treated like a colleague or a junior faculty member.
I think our PGY2 program is a great fit for candidates who are interested in academia. So we have a strong clinical component with the VA and Piedmont as our core sites, as well as other electives to complement residents' interest. In addition to that, there's lots of opportunities for teaching. And so teaching in the classroom, precepting students, teaching in labs. If academia is of interest, we have a very strong curriculum to support development in that area.
The academia component of this program is very large, and for residents who are interested in doing anything in academia, I think sets them up well to pursue any career, whether that be practice-based or wanting to go into academia.
Me being not so far removed from pharmacy school here at UGA, I get to give back to students that are in the same shoes as I was just a couple of years ago, and be able to get in front of them and teach and develop those skills as well.
I think the practice component makes it very unique. So the resident gets to practice at two different sites. One at the VA, taking care of veterans, and then also at Piedmont, where they get to take care of patients who are commercially insured, Medicare patients.
I love getting to serve veterans. I have several veterans that are in my family, so that's near and dear to my heart. And then Piedmont also offers unique challenges and perspectives with medication access, but also getting to see different patient populations over there as well.
When residents first join me in clinic, we assess where their strengths are and where they need more work. So some residents will have had great exposure to Epic. Residents who've been in the VA may not have ever used that EMR. So we first at baseline figure out where we need to go with just the logistics. Generally, I have the resident shadow me for a day or two, and then we move pretty quickly into having them see patients independently. Towards the end of the residency year, the expectation is that residents are carrying a pretty full patient panel. We're splitting our patient load and working side by side as peers.
We have a high level of patient care when we practice at the VA with our scope of practice, which means that we can initiate, change, or discontinue medications, order labs and order consults and all of that sort of thing for all of the patients that we see and for disease states for which we see need optimizing.
It's an opportunity to see the whole gambit of what clinical pharmacists can actually offer to healthcare, and in our residency program there are many opportunities to further their knowledge base.
You're doing everything. Patient walks in, a particular patient walks in, and you never know what that patient is going to request, and it can run the gamut all the way up to maybe we have to then triage to a tertiary setting into the hospital. So it runs the gamut wide open.
We've had several residents that have gone into clinical teaching positions with universities. We've had several residents go straight into clinical practice with the VA.
The program itself is challenging, but very rewarding, and it gives you a different perspective on clinical pharmacy.
I always talk with the residents throughout the year and ask them at the end of the year how they feel about their accomplishments, and they're always so amazed at everything that they have accomplished throughout the year, from just developing their patient care skills as well as all of the scholarship and the teaching that they have completed. It's just really a great experience.